Okay, first up we start with feeding pigeons. It kind of feels wholesome, right? Like something straight out of a movie or a piece of art. We've seen some lovely, splendid visuals in movies, across Instagram, social media platforms. But while you're tossing food grains at them, these birds are also leaving something behind, and the numbers tell a worrying story. India's pigeon population has shot up by over 150% in just the last 2 decades. Delhi alone, in fact, is home to more than 2 crore pigeons, making them one of the city's most abundant bird species. With every pigeon producing kilos of droppings each year, the fallout is just about everywhere. Corroded cars, damaged facades, clogged drains, and entire balconies coated in filth. But here's how it turns dangerous. Dried droppings crumble, they turn into dust and linger in the air. Cleaning a balcony or even a strong gust of wind is enough to release spores and bacteria straight into our lungs. Doctors hence warn this exposure can trigger lung diseases like hypersensitivity pneumonitis, also called bird fancier's lung, and infections such as histoplasmosis and cryptococcosis. The Bombay High Court, in fact, has already banned pigeon feeding in public spaces in Delhi NCR. 2 residents are demanding similar restrictions. Other global cities have gone further. New York, for instance, uses bird birth control. Singapore fines feeders. Germany replaces eggs with dummies to keep numbers in check. So why are Indian cities struggling so much with the fallout of overfeeding, and how much of a health risk, most importantly, are we talking about here? Before we give you all of these answers, let's go across to this ground report filed by my colleague Kuheena that shows you the several realities surrounding bird droppings in our country. Take a look.
Well, feeding pigeons feels peaceful, right? Yes, it does. But what if I told you this act of kindness could literally be taking your breath away? Yes, you heard that right. These peace birds are the most pampered, yet the most problematic citizens and residents of the city. Let me explain how. These fluttery feathers is a perfect, mesmerizing, candid moment for your morning reels, right? No. Prolonged exposure to bird feathers could be leading to pulmonary lungs diseases. Yes, you heard that right. Also, these bird poopings or the pigeon poops that you see, if they drop on your car, it could erode the first layer of paint. Yes, it is acidic enough due to a lot of uric acid. Now the second part and the interesting part, now when this poop dries away, it also is getting converted into dust particles which you eventually inhale. So despite such mess, stink and chaos, why are we still feeding this toxic love story? Let's find out.
इनका सब कुछ अगर हम सब नहीं सोचेंगे तो इनको कहाँ से खाना पीना दाना मिलेगा। तो ये सब है कि सभी लोग मैं हूँ और मेरे जैसे बहुत लोग आते हैं डालने के लिए। शांति मिलती है कि चलो यार किसी का पेट भर रहा है, लेकिन हालांकि हमारी इतनी औकात नहीं है कि हम कुछ कर पाएँ, लेकिन मन को शांत करने के लिए और इनको भूखा देखा नहीं जाता।
While compassion is pouring freely, health experts say that the droppings that follow could cause serious lung infections. From simple allergies to hypersensitivity pneumonitis, it's more dangerous than it actually looks. By overfeeding these pigeons, we have changed their diet, made them dependent on us for food, and clearly we have also disrupted the local ecosystem. So we try and reach out to the experts to tell us how.
First of all, the pigeon that we're talking about are the feral version of the blue rock pigeon, which is found in the wild as well. And these are birds that are sort of urbanized over the decades or centuries, and they've got used to being artificially fed. Now, in an urban environment like Mumbai, there is availability of water, there is a lot of shelter. All the modern buildings are constructed in such a way that roosting sites and nesting sites and everything are found in abundance.
It's not just an environmental concern, it's a civic headache too. RWA members say that the droppings clog drains, damage buildings and make maintenance a nightmare.
Big challenge for society just because of increase in numbers and population, we can see, right? They are creating multiple issues in society. Just one first issue is their droppings, right? Which will create a dirt to the regular residents which we observe in the society. They are residents and they are filling just because of issues in their balconies, right? Common areas, stairs, and the vehicles they are placing, right? So their dropping will create extra amount which need to pay by RWA, right? By cleaning to the society, providing clean atmosphere, right? Then the drainage system also get choked just because of these dirts.
So, from clogged drains to corroded cars and now even compromised air, our little acts of kindness seem to be piling up in all the wrong ways. Maybe it's time we rethink what compassion really looks like in a concrete jungle.
Okay, on that note, and to answer all of those questions, joining us this morning is Dr. Vivek Nangla, Head of Pulmonology at Max Saket Healthcare. Good morning, Dr. Vivek. Thank you for being with us here. A story that perhaps has gone under-recognized, would you say, because there's so much harm that comes with these pigeon droppings, and not just pigeons, there are other birds as well. So first up, answer that question for us. What do these pigeon droppings do to our lungs? So for instance, a pigeon dropping is in your home surroundings, gets dried up, somehow enters your lung. What happens next, Dr. Vivek?
Thank you and a very good morning to all of you. It's really a pleasure to be on this very prestigious show. So, pigeon droppings, which we innocuously think that, they can be harmless, actually can be very, very harmful and can even be life-threatening if they continue to lead into a progressive kind of a disease. So as soon as the pigeon droppings dry up, they start to disseminate into the air, and when you inhale those particles, they actually go deep inside the lungs and then can start off with just an allergic reaction like precipitating an asthma kind of an attack. They could lead to a disseminated kind of an infection with two kinds of fungi, which is again very complex and difficult to manage. One is cryptococcosis and the other is histoplasmosis. And third, and the most common reaction, is a hyperallergic response. It's also called an extrinsic allergic alveolitis or a hypersensitivity pneumonitis or a bird fancier's disease or a pigeon fancier's disease. And this is not only restricted to the pigeon droppings, but also to parrot droppings and other bird droppings. They basically result in a very hyperallergic response inside the body, which again could start with just a mild cough, breathlessness, and progress to what is called a fibrotic kind of a state in the lungs, which could actually be irreversible and life-threatening. I'm sure even during COVID, most of us would have heard of the fibrosis happening in the lungs.
Yeah.
So this is also one of those diseases which can end up into fibrosis. By fibrosis, we actually mean that the normal lung tissue is being replaced by a scar tissue. So lungs are becoming non-functional. Portions of the lungs are becoming non-functional over a period of time. And as this area of non-functionality goes on increasing inside the lungs, obviously it results in respiratory failure and finally requiring oxygen, ventilatory support, and death. So this is the usual sequelae in this kind of an illness, if not arrested, diagnosed, and treated in time.
Okay, how much exposure to bird droppings then is dangerous, would you say? And at what point should one watch out for some of these signs that must encourage them to go visit a doctor, ask the doctor to get some of those tests done because there are bird droppings in their surroundings?
So there's no quantification as to how much the dropping has to be. It could just be one single exposure to a large quantum that could precipitate this, or it could be over a period of time. It could be either way. But then if somebody develops a cough, develops breathlessness, which is lasting more than 2 weeks, I think that's an indication enough to approach a doctor and get this diagnosed and treated. No cough longer than 2 weeks should ever be ignored. It could be just a simple infection, tuberculosis, asthmatic cough, and so many other differences. Along with one of them could be a hypersensitivity pneumonitis too.
Okay. Dr. Vivek, do people not end up confusing? And this is something I'm asking you of the experience you've had with several of your patients who you may have perhaps scolded and said, you should have come to me a little sooner. You should have not just passed this on as an allergic reaction, just taken an anti-allergic. Has that happened? And how do you normally go about those cases? Because a lot of people would say breathlessness or cough or chest congestion or heaviness is perhaps being triggered because of season change, or if they're an asthma patient, then they're going to simply negate it, no?
Yeah, absolutely. I agree with you. So that is why they need to be more careful with their symptoms. If there's somebody who already has an underlying disease like asthma or chronic obstructive pulmonary disease, and they develop any kind of worsening in their symptoms, they should not take it lightly. Anybody who does not have any underlying disease and then ends up having a cough which is just lasting a little longer, and also the character of the cough would be a little different. This would be dry. This would happen more after getting exposed to the pigeon droppings. And especially if there are recurrent exposure, then the chances are that it is going to end up into a prolonged kind of a state. So, as I said, any cough, any breathlessness, any chest tightness which is lasting more than 2 weeks, for that one must approach a healthcare physician and get this addressed immediately.
Okay, now all those wondering, Dr. Vivek, that is this a real thing? Because, we played out some of those reactions in that ground report. When you typically ask people not to feed pigeons, not to encourage this, not to imbalance the natural phenomena, and how many pigeons are actually supposed to coexist with human beings in and around, they would say that this is an act of compassion, that their religious duties also seek them to go ahead and feed the pigeons on a regular basis. So just to educate all of us today, tell us why it is important that we keep our surroundings clean. More importantly, keep our surroundings clean, and how should we go about that? So for instance, if there are pigeon droppings in your home space, in your balconies, what are the ways you should go about cleaning it?
Right. So I think there are two aspects to it. One is that should we be feeding the pigeons or not? See, we have to understand that this is not their natural way of getting their feeds. We are artificially feeding them, resulting in an overpopulation. And some of these grains also have some processed stuff involved in it, which could further harm the health of the pigeons actually. So if at all we have to look at it from a compassionate point of view, probably we should think of donating it to, food shelters, or probably creating more of animal shelters for them, and probably creating some kind of a sanctuary where they could all be diverted rather than having them in your day-to-day lives and your day-to-day activities. Pigeon droppings can be very harmful, as I just said, and it is important to, if you have a lot of them in the surrounding, then best thing is to avoid them as much as possible. If the direct contact is not avoidable, then I guess you have to handle it with wearing a proper protection gear, like wearing a mask, N95 mask, if possible, a helmet as well. And then you should actually be wet cleaning it, moisten it with water first, because it's the dry poop that actually gets inhaled into the system. So you have to wet it first with water, sprinkle it with water, and only then clean it.
Okay.
And even when you're doing that, you should be wearing your gloves, you should be wearing your mask, and limit the access of pigeons. There are enough of these devices now that are available, the spikes that are available that you can keep on your parapets and in your balconies that would avoid the pigeons from sitting there. And of course, hand hygiene is very, very essential. If you've been anywhere near the parapet, touched anywhere, then you must wash your hands properly with soap and water.
Is it just pigeon droppings or perhaps pigeon feathers as well? Should we watch
Pigeon
out for
feathers
that?
as well, yes.
Okay.
Pigeon feathers can also trigger off an allergic reaction.
Okay, Dr. Vivek, what about immunocompromised people, for instance, or people with lung conditions already? Are they at a higher risk of damaging their lungs due to this kind of exposure to pigeon droppings?
So we call them the high-risk group or the vulnerable group, who would always be prone to developing any kind of an hyper reaction to, anything in the environment, whether it's the air pollution or the pigeon droppings or the viral infections like COVID, influenza, anything and everything. So this high-risk group or the most vulnerable group would include people who are elderly, like more than 60 years in age, children less than 5 years in age, those who have any kind of an immunocompromised state, like diabetes, kidney disease, heart disease, those who are on regular medicines like chemotherapies, steroids, those suffering with HIV and other kind of conditions, those who already have a pre-existing lung disease like asthma, COPD, interstitial lung disease. So these are the people who would definitely be more prone and definitely need to be more careful and follow all the possible precautions as far as exposure to not only the pigeon droppings but the entire environment is concerned. They have to keep the environment very, very hygienic and clean.
So if, let's say, someone has been coughing for 2 weeks and there is a significant exposure to pigeon droppings in their surroundings, they've been feeling breathless, all of those symptoms have been showing up. Of course, they're going to head to a doctor, but tell us also a little bit about what kind of tests, if at all, exist that are done specifically to detect this.
So basically, I think what is very important in these kind of patients is to have a detailed history. The doctor also needs to spend 5 minutes extra and get that detailed history of the environmental exposure. That what kind of exposure they've had in their recent past that could have precipitated this breathlessness and cough. Second testing is a CT scan of the chest. A high resolution CT scan is able to give you a very good diagnostic indications whether this could be hypersensitivity pneumonitis or not. Third is a test called a blood test, which we do a panel, which helps us diagnose if there has been an exposure or not, which is not so reliable, but yes, it does give you a good indication. Fourth, of course, is if nothing else works, then one could do a transbronchial lung biopsy, which again is a very simple procedure done under local anesthesia with a little bit of sedation, where you do a bronchoscopy. Bronchoscopy is like endoscopy of the stomach people get done. This is the endoscopy of the lungs, which is called bronchoscopy, and you could do a biopsy from inside. Then, of course, pulmonary function test, which again would tell you if there is any restriction in the lungs or not. PFT is able to differentiate between asthma and a restrictive lung disease. So these are the various tests that one can undergo to reach a diagnosis. But again, a proper history is very, very essential. Exposure to any kind of pigeon droppings or anything else in the environment is very, very important to be known by the physician to reach a diagnosis.
And battling a bird fancier's disease, also Dr. Vivek Nangla, does it vary from person to person? What does your experience tell you? So for instance, somebody comes well in time, gets it treated, you're going to perhaps prescribe some steroids. What are the survival chances there? Because there are so many worrying reports that signal that it may eventually lead to total lung collapse too.
Right, absolutely correct. So I think what is important is to understand that if there are two stages, one is the inflammatory stage and the other is the fibrotic stage. And it depends in which stage the patient reaches us. So if it is in an inflammatory state where there's not much damage done to the lungs till then, one can start them on steroids, control the progression of the inflammation with steroids. But once fibrosis has set in, then you have very limited options. There's only one antifibrotic or two antifibrotics that are available to us, which can not reverse the fibrosis, they can only slow down the progression of the disease. And there are also certain disease-modifying agents that one would use. But please understand that the treatment options are very, very limited.
Yeah.
Now, of course, the option of lung transplant also is there. But again, at very few centers with not as good results as you would expect. So that's still a huge limitation there. So what is important always in any kind of hypersensitivity pneumonitis? I mean, like pigeon fanciers is one, there's so many others as well, like exposure to cotton fibers, to sugarcane, and all those things. Even dampness could result in hypersensitivity pneumonitis. But yes, what is important is to avoid these exposures as much as possible. Treatment options are very limited. Every individual may behave differently. There would be people who have go into a remission kind of a phase and remain static for years with certain degree of lung limited activity that is possible, while there would be others for whom it could be an acute disease where it could just rapidly progress and deteriorate and may not come under control despite all possible measures.
Dr. Vivek, would you call this a silent killer? Because so many people are unaware that this could happen to them. Pigeon droppings could be so harmful. In fact, so many are unaware of the kind of pigeon droppings in their immediate surroundings, in their immediate environment, because sometimes you have window ledges, for instance, at a certain height, so you don't typically end up cleaning it on a regular basis, so on and so forth. So what would be your suggestion to everyone watching this who's saying, how do we monitor our immediate surroundings to an extent that this is not going to be dangerous going forward for us?
So, pigeon droppings is still something that is visible as compared to so many other pollutants that are in the air that could be harming us silently. Of course, it is a silent killer for sure, but at the same time, it is visible to us. So this is something that we can definitely take care of ourselves. If you know that there are pigeon droppings on the balcony, just follow all the possible precautions. First of all is avoidance. Second is preventing the pigeons from sitting there and leaving the droppings behind. Because again, it's not just the droppings, as you also pointed out, the pigeon feathers can also harm the lungs. So what is important is avoidance of pigeons as much as possible. And not just pigeons, but any other bird droppings as well, which includes parrots. There are people who have parrots inside their houses like pets. They've also landed up in various kinds of complications that we've seen coming to us, again with the same cough, breathlessness, especially in children. It can be even more harmful.
And very quickly, Dr. Vivek, why is it so under-recognized? Is it because the pigeon population has shot up the way it has? We're looking at 150% increase in the population over the last 2 decades. Have you seen that translate to the number of patients who are coming to you with an HP?
Yeah, you're right. Actually, though, if you retrospectively, if you think the number of patients has only been going up, but that I think that's also because the awareness has gone up now. Earlier, if you would have a patient who would come to you with breathlessness and you would diagnose it to be an interstitial lung disease, you would probably just, because we did not have the options of treatment available to us, you would just treat everybody random as at a blanket with steroids and with some kind of a antifibrotic and a disease modifying agent. People would not be going into the detailed history of the exposure. Even the patients themselves would not give you that history because that awareness was not there. Now with increased awareness, increased diagnostic facilities available to us, and also increased in the number of pigeons, this disease is definitely becoming more and more common, and we are seeing it more often now for sure.
So you got to ensure that your immediate surroundings are foolproof. You're meshing it up, you're going ahead with all precautions, and most importantly, cleaning your surroundings the right way. So get your masks on, wear your protective gloves while you're cleaning it. And like Dr. Vivek said, what's important is to ensure that you're cleaning it after pouring some water, let's say. So don't let it dry out and let it wash off on its own. Thank you so much, Dr. Vivek. It was lovely having you this morning. Thank you for simplifying that story for us.